On today's episode, we look at an emerging biomedical technology, the self-healing body. The development of devices to automatically deliver treatment to the human body precisely when needed has gained a lot of traction in recent news. A group from Berkeley has developed a wireless device that can be injected into individual nerves. The device will detect electrical activity in the body and then stimulate the necessary therapeutic reaction. 2 devices have already been FDA approved. One stimulates the airway muscles to treat sleep apnea, while another stimulates the vagus nerve to make morbidly obese patients feel full. Meanwhile, a group in Israel is developing a nanobot which can hold a drug and deliver it when needed using brain activity. Preliminary tests with cockroaches have shown success in releasing the drug when a person starts doing mental math. Researchers believe this can be used to detect brain states that signal difficult to diagnose mental conditions, such as ADHD and schizophrenia, and release drugs only when needed.
This technology would mainly impact medical patients of first world countries. This is because the surgery requires an advanced setup and will likely be expensive. At first, these nanobots would only be used in special cases, on high-risk patients in which there are no other current solutions. However, as more research and clinical trials are conducted, the technology may become more commercially used for common diseases.
The driving development of this technology is fundamental to simplifying the daily lives of those who depend on traditional drug delivery. This technology would create new treatments that can be tuned automatically and continuously to the needs of individuals. Furthermore, drug delivery is difficult. The active ingredient circulates the entire body, often causing side effects. These solutions would only target specific cells in the body, minimizing harmful interactions elsewhere in the body.
The primary users are those who are using the device, such as patients with disorders, as previously mentioned, and people who would like to benefit from the device. For instance, those who would use it for insomnia or those who would need a caffeine boost. The secondary users are physicians and family members of the patients. With new technologies, we always question the accuracy. The device seeks to detect electrochemical signals within the body. However, how can researchers and scientists maintain accuracy and ensure the right treatment? As researchers, we need to be beneficent. This technology assumes there's a biochemical sign, but this is not always going to be the case for all diseases. It would be challenging to build it to sense specific diseases without impacting other functioning parts of the body. Also, the patient does not have control in terms of the treatment, since it is automatic, hindering their autonomy. This technology needs to be well tested and closely monitored throughout the period that it is in the body. There are possibilities that it will malfunction, causing it to misdiagnose and treat something that doesn't exist, leading to unwanted side effects. They must design for failure in the case where this does occur. There should be a way to reverse the effect or temporarily disable the device.
There is a high risk that individuals will misuse nanorobots for recreational purposes to provide similar reactions from alcohol and drugs. Furthermore, there's a high risk for physicians and surgeons to see the economic potential in this technology. As a result, they can monopolize on individuals who are willing to pay a high price for a weight loss maintenance solution. Since this technology has the possibility to substantially alter the personality and cognitive ability of an individual, it is critical that it is monitored similar to controlled substances. As engineers, it is our ethical obligation to the public's well-being to ensure this technology is used appropriately and safely. Furthermore, to avoid the possibility of misuse for electroceuticals for weight loss maintenance at a high cost, the surgeons must follow strict regulations.
Hacking is a hot topic these days. Any device that connects to the internet or to remote controllers risks the threat of being hacked. This includes these nanobots. Hacking these nanobots would put these patients' lives in danger and could compromise their autonomy as an individual. In addition, this hacking can happen from distances of up to 100 meters away, so the hacker would not even have to be in the same room as the patient to cause harm. The best way for us to address the threat of hackers is to stop them before they get their hands on this technology. We would be violating our ethical duty to the public by not taking any actions to ensure that the nanobots are secure. This means that end-to-end encryption needs to be in place on the signals that get sent to the nanobot, either from the internet or from the controller. It would also be acceptable if the device was fully autonomous and did not remotely connect to anything, thereby meaning it could not be hacked. Should a controller be used, it would need to be secured by a passcode to ensure that the device cannot be used by the wrong person. Despite the potential abuse, this technology has the capacity to assist a wide range of individuals who are struggling every day. From a consequentialist point of view, the benefits substantially outweigh the risks of those who may abuse the technology. However, the technology must be secure and foolproof to ensure that the autonomy of the individual is maintained.